Hi, guys, and welcome. Hi, Annalie. Thanks for joining me.
I'm glad to be
Is it
here.
Anna? Is it Anna or Annalie?
Annalie, yes.
Annalie. Okay, that's good. I'm an Anna as well.
Okay,
my
very
my
good.
proper name is Anna, so it's always nice to speak to another. Guys, if you're joining us live today, it is so good to have you. We're here on this platform so that we can have a conversation, engage with you, answer your questions. I see there's already plenty of you with us. Please introduce yourselves and let us know who you are and where you're from. We're here to have a conversation with you. So ask your questions, share any insights or experiences. We're here to learn from each other. So yeah, I'm really excited about today. So Annalie, we are going to be talking about how to structure canine fitness exercises to improve clarity and promote proper muscle recruitment.
Yes.
Okay, so I see people are still flowing in. Guys, welcome. It's so great to have you with us. Hi, Nadia, you made it. That's awesome. And Natalie, thank you for joining us from the UK. That's awesome.
Oh my goodness.
Wow, from Norway. Welcome, guys. Sure. Okay, I think we've just hit record numbers of lives for a Facebook Live. So, wow.
Wow.
Hi, guys. Whoa,
Wow.
incoming, that's amazing. Okay, Annalie, will you please introduce yourself? Tell us a little bit more about your journey to where you are today and what it is that you do and what your interest is in today's topic.
Yes. So I'm Annalie Sanders, and I know so many of you. I see your names popping up, and I'm just like overwhelmed with the support in this. I came to canine fitness through human fitness. So the first 18 years of my career, I spent teaching functional movement, Pilates, and yoga to humans. And I specialized in two main populations. So, the first population I specialized in is people who were discharged from rehab, but weren't confident yet in their body or how to move, or they didn't know how to feel their body or how to move without pain. And then the other population I worked with were people who had compensatory movement patterns, poor posture, tight shoulders, didn't know how to engage their core, weren't sure about alignment, and they were starting to regress into pain. So I had people who had pain and learned how to compensate. And then the other side of the spectrum, we're adapting to lack of coordination, muscle imbalances, and we're starting to fall into pain. And so in my professional journey, I learned from some fantastic teachers, and this will kind of tie into the topic. I learned from some fantastic teachers that the best way, the most precise way to ensure that people were executing correctly and using their bodies correctly was to layer exercises, simple exercises that built one on top of the other that ensured they understood with their brain. So, in human terms, this is called neuromuscular re-education, that yes, their bodies could move, but more importantly, their brains understood, right? And so here I am, a human fitness instructor. I'm also competing with my Border Collie Hot Rod in agility, and I travel across the country to go to this 3-day agility seminar. I'm super excited. Day one, jump 3, I send her over a jump. I execute a blind cross. I turn my back to her and I start to run to get to the other side of a straight tunnel. And all I hear in the background is the instructor saying, "Stop, stop, stop, stop." And I look up, and my Border Collie, who is the love of my life, comes out on 3 legs. And she had a full catastrophic CCL rupture. And, I had been into canine fitness previous because of my professional background. But I felt so guilty. Like I hadn't prepared her well enough, that I did something wrong, even though I warmed her up and cooled her down. It was like the worst moment of my life, which is saying something because, anyways. So we got her in to have a TPLO within 24 hours from a very experienced surgeon. We traveled back across the country, and I went to my first rehab session with my rehab professional. And we started with the underwater treadmill, which she wasn't super excited about, but that was fine. We brought her out of the underwater treadmill, and the first exercise we did was on the peanut, opposite leg lifts. And as you know, my rehab instructor is lifting her onto the peanut where she's still a little bit wet. She's a little bit unsure. She's being manipulated. I'm starting to have like a high key panic attack. And I just ask her to stop. Like, please just stop. I am not feeling comfortable about this, because from my human background, I know that people cannot learn when they are in a state of stress. That they cannot learn well when they are in a state of stress, that they will fall back on their default setting, their default muscle recruitment pattern, and recruit the old way instead of the new way, right? And in her defense, she immediately stopped, and we were able to troubleshoot and come up with a better solution that would still recruit those muscles, because Hot Rod was a trained dog, that I could use dog training to implement these human fitness skills like a square stand. And I was able to implement a independent front leg lift, an independent rear leg lift. And we were able then to troubleshoot and come up with a solution that was going to be better for Hot Rod, because she was unsure about the environment. She was trigger stacked because of the experience. She was in pain, because she's only 2 weeks post-op at that point, and taking her off of the elevated peanut, going to a low, stable surface, simplifying the exercise actually helped her recruit better, right? So that is how I got into all of this crazy canine conditioning stuff in the first place.
I love that story, and I think that's so valuable because it highlights some of the areas where we are a little bit weaker as vet rehabbers. And let me start with just welcoming everyone again. We have 210 viewers live.
Oh
this is like summit level attendance, guys.
I am so excited.
Anna, this is not the last chat we're going to be having.
Okay.
So guys, welcome. It's really great to have you. Welcome everyone that says hi. Amazing. Thank you for joining us. If you have questions, please post them in the comments, and hopefully we're not inundated and I actually see them and can ask those questions. If I do miss something, what we're going to do is we're going to tag Anna Lee after the recording, and she's going to come back and answer them for us. Okay. So welcome. Thank you so much for joining us live. We're really excited to have you. So with all the love and respect for my profession, because I think we do the most phenomenal work, I love what we do. I often feel like there are the therapeutic exercises hold the most power and are also the most difficult, because every patient is different. We have to approach them. I feel like we have to approach them much more slowly, much more carefully. It's so fun with dogs when we have all these tools and toys, right? To use all the tools and toys. But there's a disadvantage if we just go straight into using all the tools and toys, or if we're just luring, which I feel like I'm mostly just luring because I don't have the trainings, I don't have the skill set to be able to stack and build those behaviors, which is where the power lies from a neural perspective. And it's, if we can shift our perspective from training the muscles to training the fascial and the nervous system, we will have way better results. And that means smaller and less, right?
And
Okay.
simpler,
And
simpler.
simpler. It's not actually about all the toys and the tricks. It's about how well do we perform them, and
Right.
what is the patient's, mechanics? How are
Mhm.
they recruiting? Is there limb in alignment? All things that we struggle to see if we're going too much too quickly. So I
Mhm.
love that you're bringing that perspective in. And if there are, I think most of these people are actually dog owners, I
Mhm.
think, and trainers, I think.
Yeah, yeah.
It's so good to have you guys. Where are my vet rehabbers at? um, this highlights to me that, as vet rehabbers, one of our core things is that we can learn from anyone and that we will never stop learning.
Right.
And so thank you for sharing that. Oh, okay, here we go. First question. I'm a canine physical therapist. Wonderful. Where are my vet rehabbers at? I have a question about the overload principle. I struggle with feeling like I'm not overloading patients, especially when we are getting to return to sport. I understand that loading over the spine is not recommended due to the anatomy of a dog's spine, but what about adding loading over the shoulders or hips during exercises? How do you make sure you are continuing to overload the body? I love
Yes.
that.
Yes, that is a great question. So there are several human studies that say that the muscle development, the hypertrophy that we're looking to develop, especially when we are increasing demands high enough that they meet the demands of sports, agility, flyball, bite sports, lure coursing, duck diving, all of those types of things, that the hypertrophy actually comes from controlling the negative. So, yes, it's about increasing weight, maybe, but we can
Mhm.
do that effectively by raising the height of the front limbs if we're trying to load the rear, or raising the height of the rear limbs if we're trying to load the front, and effectively controlling the negative. Um, uh, in this particular study, it said it didn't even matter the duration of the individual repetitions, except that the negative had to be 2 seconds to 8 seconds. That was the most effective range of creating hypertrophy of the muscle. And then when we combine that with a plyometric principle of then explosion on the concentric phase, the positive phase, that those two things together increased muscle mass the most significantly, because we have to realize that the tissues in the dog's body are adapting to body weight. That
Mhm.
dogs, for the most part, are only dealing with their own body weight in sports. So we can then use that body weight effectively. Again, control the negative, work plyometric on the positive to have those sport specific adaptations. But that all builds on a solid foundation, right? And
Mhm.
sometimes I feel like we get really caught up in the fanciness or the difficulty level
Mhm.
of the exercise, when really, like any dog training behavior, the foundation of understanding, when the dog understands how to hold their body in neutral position, how to properly load into the rear, how to keep their feet still, the limbs aligned in neutral, that's really where the more fancy stuff or more difficult stuff builds. That solid
Mhm.
foundation allows me to say, okay, hot rod, I want you to execute this fold back down slowly,
Mhm.
right? But if I don't have a solid foundation, it does loading in the negative is not even really possible.
I love that. I had a client ask me about this like 3 weeks ago,
Uh-huh.
because and I'd like for you to go a little bit into fatigue as well, because what I was telling her is, when you see the first signs of fatigue, I need you to stop. And
Hmm.
her response was, well, how are we supposed to build muscle if I can't work past fatigue? So
Yes.
can you talk a little bit about that? Because I actually didn't know how to answer her.
Yes, that's a great question. And I actually was having this same conversation with a friend of mine the other day. She is preparing her dog for world team agility competition. And she messaged me to say, hey, I'm spending all this time refining behaviors. And I feel like I'm not really getting a good workout for my dogs, right? And it really is a balance. What we're looking for is 85% accuracy because, to your point, if it's 100% accuracy, if my dog is executing 10 out of 10 repetitions times 3 sets perfectly, the exercise is not hard enough, right? So I'm looking for that 85% accuracy. So 8.5 out of 10 repetitions times 3 sets that they're able to execute. And so the first sign of fatigue that I notice is arousal levels changing, that the dog will start to get either a little bit too excited, usually that's the direction, but it could be stressing down. And what I will typically do in that moment is take a short pause. So I'll pause within the exercise, give the dog a chance to think, calm down, let their muscles rest for a second, and then go back into that same set so that they have a chance to regroup. And for any of us who have worked out, sometimes it's nice to just take a beat, take a breath, right? And then go back into your, set of burpees or squats or RDLs or whatever it is you're doing. And so that's kind of what, right? I know, eyebrows up. That's what I kind of
That's
recommend.
the point where I'm like, oh, I'm done. Thank you.
Right, is to give the dog a chance to calm down for a second and then continue. Because yes, if it's too perfect, if we quit at the first sign of fatigue, then yes, we are not allowing the muscle to become loaded. But the flip side of that is if we continue once the dog's form is compromised, we're actually not targeting the muscles that we want to target anyways. And we are building in muscle imbalance and incorrect execution of the behavior. So it is a balance, navigating that 15% extra to, maintain good enough form and also create that overload.
I love that. Thank you. That definitely gives me a way to think about that and potentially chat to my client. Thank you.
Excellent.
All right. Jackie asks, when dealing with untrained pet dogs, what are your top behaviors to teach owners to start working on at home?
That is a great question. And if you guys haven't seen my website, I have a ton of free resources on purpose on my website for this that you can use, that you can refer your dog, your pet dog people to. So the first most important thing that I use is a training loop, so that the dog understands the pattern of behavior that they need to move through to execute any exercise. So, and for me, that includes a reset cookie. So I place or toss a reset cookie. I help the dog approach the stable targets. I'll use a stopper cookie to stop their forward movement and then ask for the behavior, whatever that is, and then give them the reward and then start again so that they always have value in their training. So always a training loop, and it gives the human side something to do if they don't know what's happening. Like just reset and start again, right? And so that really empowers the human side. And then from a skills perspective, for me, everything starts with foot targets. So a front foot target, a rear foot target. And once I have those two skills, they can develop into anything. They can develop into anything. Once I have the placement of the dog's feet and I build value into interacting with stable foot targets, I use, raised foot targets to define the space the dog's feet should stay within. And then I can manipulate the position of those foot targets to move the front feet more forward, move the back feet more forward, move them both to the side, narrow the space the feet need to stay within to bring, a dog who is base wide into more neutral alignment or even into adducted alignment. So we can then, without having to free shape the dog into neutral stand position in the middle of the room, which is like way too much. And for me even, and I consider myself a pretty efficient dog trainer. But if I can use the foot targets and the training loop, I could really train anything. And again, going back to a simpler behavior, if I can teach the human side how to teach a few simple exercises and they can be successful, then they have buy-in, right? They're into it now because they can be successful for their dog. But if I overload the human side and they get frustrated and they feel like a failure and they can't do it, they're not going to do their homework.
I like that. There are actually two thoughts I'd like to build on there.
Yeah.
Firstly, we have a question from Zelda. What is the negative?
Oh, yeah.
Yeah.
Okay,
is that
yes. Perfect. Yes. So the negative, that's a great question, right? So let's say so we'll put it in human terms first. So for humans, if we're doing a bicep curl, when the muscle is shortening and moving up into gravity, that's called the positive because the movement of the muscle is contracting during the concentric. And then instead of just letting the weight fall down, we slowly control that eccentric or elongating phase of the muscle, that is actually where the strengthening portion of the work happens, is controlling the return back down. So for a dog doing like a rock back sit, so if the front feet are elevated, a rock back sit, that slow transition from stand to sit would be considered the negative because they're slowly resisting gravity, where the positive would be the transition from sit to stand. The same thing from a stand to a down position, the transition downward where the dog is moving slowly from stand to down would be the negative. And then returning back up into that stand position would be considered the positive.
Okay. Thank you. I love that explanation.
Okay, good.
Yeah, and Zelda says, thank you very much. I never understood.
You're welcome. I'm so glad you're here.
That's perfect. And hi to all my vet rehabbers. I see you guys. Thank you. It's so good. All right. So you were talking now about when the human part of the equation is successful at these simpler, what feels like a really simple exercises, then they get buy-in and then they want to continue. So what if your owner how do you strike that balance between, okay, they're being successful, but also they feel like they're doing something worthwhile, right? Because I can often find that an owner feels like, well, what is even the point of standing on a block because I'm not achieving anything. My dog's not achieving anything. So how do you strike that balance between them feeling like it's worth the time because they're doing something and them being effective or them being successful?
Yes. And that's a great question, and I encountered this a lot in the human fitness world. People came to me wanting to hurry up and make their shoulder feel better, right? But if the human, in the context of human fitness, if they couldn't even stand up straight, if they were standing with a rounded spine and forward shoulders, what's the use in me adding weight to their arm until first they could transition into proper posture, right? And the same thing is true for our dogs, that there's not no benefit, but reduced benefit to, let's say, an opposite front and rear limb lift if the dog is externally or laterally rotated through the limbs, if their spine is in flexion and a roached curved position. They are not actually getting the benefit of that exercise anyway. So I typically start with educating the human on the difference between the postural muscles, which are the deep core muscles that lay close to the bone, versus the global movers, so the local stabilizers, versus the global movers, and how, especially in recovering or transitioning from rehab to fitness, which is my specialty, and or in rehab, dealing with neuromuscular reeducation and rebalancing the muscles in the body, that those postural muscles are really what we need to target first. And if they can start to see changes in the dog's posture and the dog's alignment, then they will understand and feel like they are benefiting their dog. And once they have those postural muscles developed, then we can start to introduce more advanced or fancy things. And, I always start really like far down. And then when we are at something like a manual front leg lift, because that is, if you think about it from a dog training perspective, a front foot target, a rear foot target, stillness, and a leg lift. That's kind of a complex behavior for a dog. I explain it to the human in those terms so that they can really see how well their dog is doing.
Yeah, I love that. So we're not just doing this thing. Look at all these ticks that we're, look at all these things we're achieving. I like that. And it's also when you have that foundation really solid, it's much easier to advance and to do the fun, fancy stuff. And then it's easy. Things become really easy, which makes them fun.
Yes, it does. Everybody likes to be successful.
Yes, welcome everyone. So we're now up to 229 viewers. It is amazing to have you guys with us.
Guys, this turnout makes my heart so warm.
I'm excited. It's January. We're kicking off the year properly. I love it. Join the conversation, guys. Ask questions, share your experiences. That's what we're here for. This is a Facebook Live, so it will be recorded and on Facebook. It will be on the Online Pet Health page and in our Small Animal Vet Rehabbers group. And I'm sure Annalie is going to share it as well to her pages. So wherever you see the broadcast now, it will be there as a recording when we finish up. Okay. All right, so Stephanie wants to know, for someone wanting to teach canine fitness, where should they start? I would love to get into teaching canine fitness, but I am a long way away from that. It's never too late to get started. Hey, it's never too late to get started. Yeah.
That's the truth. This is my second career. So yes, it is never too late to get started for sure. But there are canine fitness is completely unregulated. And so moving through a program, going through a program that is taught by appropriately credentialed individuals, that includes case studies after the education portion to prove instructor understanding, and has a comprehensive exam. Those would be the things that I look for in a program that I wanted to pursue. I am actually going through Bobby Lyons' CSCC program right now. Shout out to that. It's fantastic. I've just started her material as my second canine fitness credentialing, because I'm always learning and I'm always looking to, find out what the newest thing is, to learn from more people. So, there are a variety of different programs located across the globe. Some have online only, some have online and in person, some are completely in person. But I would look for those three things to make sure that the person teaching your program has appropriate credentials, that there are case studies included, because you don't want to go through a class, pay your money, and then be done. and then like be left feeling like, oh my God, I don't know what to do. That's the worst feeling. So case studies, and then there should be an exam. Those would be the three things that I look for. Yeah.
Okay, that's perfect.
Yeah.
Thank you.
You're
Thank you
welcome.
guys for all of these questions. I'm going to try and kind of make them specific or relevant to rehab.
Okay.
But these are really great. So for dogs that are really fast and reactive and are prone to frustration, how do you help them slow down?
Oh, yes. Yes. That is a good question. And I feel like a broken record, but the answer is to make things simpler. So for any dog that is exhibiting over arousal, that means that they don't understand the pathway to the reward, and or they are confused with the reward timing or the marker timing. So for a dog that is moving into an over aroused state, I will, one, make the movement pattern simpler and more repetitive. So in my curriculum, I keep things very simple in that, for example, I will only do a fold back down to stand. That's the only movement pattern the dog has to execute in order to earn their reward, versus fold back down, sit, fold back down, stand, a little hiccup. I don't make the movement pattern complicated or complex because I find that increases frustration. So I keep the exercises simple. If the dog is getting too over aroused and their brain is, falling out of their ear, I will then take a short break in a controlled position, right? I ask my dog to come off and lie down, and then we try again. And I try and keep things very simple and provide a very obvious path to earn a reward. Because if the dog is feeling over aroused, that means that they have a question mark. And I don't want that question mark as much as I possibly can prevent it.
You also mentioned that loop earlier where and when you were saying that, I was like, well, that is a very high frequency of reward, right?
Yep.
The dog is getting a cookie at all the time.
Yes, yes, yes.
So that's a lot of reward, right? We're not just rewarding them when they execute the movement we're asking for. There's a whole all the time. Does that also play into reducing that arousal and helping them to slow down a bit?
Yes, I find that to be the case, right? So I have currently 2 border collies and a field bred Labrador, and there's no one more food motivated than my Labrador, Ron Burgundy, right? And so he's excited to work out. I actually have to keep a gate on this room so that he doesn't come in here. But when he does, he is so excited. So I do use that training loop to get started so that he has an easy way to start to earn his reward. And then once he's settled into a moderate state of arousal, then I can start to increase the challenge and focus on the exercise. But yes, using the training loop provides a simple path for the dog to earn a reward. Even if they fail the exercise component, then they still get paid.
Because that increases frustration, right? If they're unable to earn the cookie, that's okay. No, I love that. And I've heard I'm more of a horse person, and I've been learning more about the positive reinforcement in the clicker training. And there's a thing where they have to have like an opt-out bucket, so they get free food. They don't have to work for it. They don't have to earn. They can just have free food. And that's really important for some reason that I don't know yet.
Yes.
But I'm getting that same feeling.
Everybody likes a Christmas bonus, right? Everybody likes getting a reward, even if they didn't earn it. And it makes me feel good when I know I have income coming in, even if I make a mistake that week, right? Even if I'm sick or out, right? And it's kind of the same strategy, payment strategy for our dogs. Even if you make a mistake, don't worry. You'll still be provided your reward, your income. You still get paid.
So, I mean, the opposite thought to that would be, well, doesn't that decrease motivation to work?
I mean, I have not found that to be true in the context of dog training, because the dog receives more rewards when they are more correct, and the whole loop really is the end behavior that we are trying to train, right? So the worst thing that could happen is for me to say, all done, and we leave the training room.
So, yeah, so I haven't found it to decrease motivation either. They like the work. They want to do the work. Yeah,
Yes.
like it.
Yep.
Cool. So Rochelle says there's slowly more research coming out in the human field about being less specific on form, example, deadlifting, with the theory of any movement being beneficial. There seems to be a shift in less focus on form. What are your thoughts on this? So from a human and animal physio in the UK. Thank you for that question.
Yes, yes. And for anybody else following along, this topic is relevant because in the last decade or so, we have become overly focused on being perfect in our movements all the time. And so, in the context of human fitness, there is a huge portion of the population who is so afraid to make any mistake, let's say during a deadlift or a bicep curl, that they don't even try, or they're keeping the weight so low that they're not able to affect that muscle development, that hypertrophy. And so I agree that it does not have to be perfect, but it does need to have an underpinning of understanding, right? So you will absolutely injure yourself if you don't know how to maintain proper spine alignment during your deadlift. But once you have that underpinning of understanding, and you understand what a neutral pelvis is, you understand how to maintain proper alignment through your spine, through your shoulders, then you have a little bit more latitude to play with that alignment, like, this person is saying. And that's where I kind of gather my 85% correct concept from is I want you to understand the recipe, and then you can modify the recipe. I want you to understand the rules, and then yes, you can break the rules. It doesn't have to be perfect all the time, but you do need to know how to execute correctly, what ideal is, in order to avoid injuries. And so, like anything, if we swing the pendulum too far to the side, we're not getting benefit. Too far to the other side, not getting benefit. So no focus on form, only focus on form, where really the benefit comes from that middle zone. Great
I love
question.
that. For sure. Thank you for that question. Yeah, for sure. So I want to remind you guys that our actual topic is how to structure canine fitness exercises to improve clarity and to promote proper muscle recruitment. So that does feed into form, right? And developing form. And I say that not because I think that I think this is a fantastic question. I think that we don't focus enough on form in our canine patients. I think that we allow any movement rather than making sure we're getting correct movement. And not, I mean, this is definitely not a rule because we are doing gait retraining and we are focused on that in certain instances. But the story that you started with highlights that, we're not necessarily building that form foundation first. And so this could definitely be something that within our industry that we're weak in and we need to develop a little bit more. And I think it feeds into that talking to the nervous system and talking to the fascial system, which is a different conversation to just building muscle or strength.
Right.
And on the flip side of the coin, when you have a patient that is obese and very sedentary, just move. Just
Yep.
go for a walk. It doesn't matter. Just get out the
Yes,
house and walk,
totally.
you know?
Totally.
Because they need to start. So I think just beautiful. All right, let's see. Um, oh, there are so many comments, guys. It's so amazing to have you. I've seen the shift, but not entirely convinced. Oh, how should you properly end a session instead of saying all done or just ending the work? What do you suggest?
That's a great question, Veronica. Thank you so much for asking that. And I'm so glad to see you here. So I always end my sessions with my own dogs with toy play or a cookie scatter, so that they find the end of the session is happy and rewarding. And also, like, we're celebrating, because usually at the end of a session, if I'm working with my young dog, David Rose, I'm like psyched that both of us got through this session learning this exercise. Or with my adult dogs, like, you guys did so well that we're celebrating that session. So with David Rose, his favorite trick is catching treats out of the air. So I'll do 10 or 15 just cookie drops into his mouth. Ron Burgundy really loves to play. He likes me to throw the toy and he catches it in his mouth. And Hot Rod, she's just like the perfectest little thing. She really likes snuggles. And so we always end where she puts her little feet on my shoulders and pushes her little forehead into my mouth, and I give her kisses right on her forehead. So, whatever the dog finds rewarding, their favorite thing to do, that's typically how I try and end the session. I'm not perfect. Sometimes I'm frustrated and I take a break and I'm like, okay, let's take a break now and circle back later. And, we just kind of go outside instead.
Okay, good. I love this question as well. How do you help clients with dogs who don't take food or are feeding raw? So,
Yep.
how do you there?
Yes. And that is challenging. So I recently traveled to Florida to teach a clinic in a rehab clinic to rehab professionals in this clinic, working with dogs who are not food motivated, in where I work, which is online, so people are in home, we control all the variables. So if a dog is not taking food in the home environment, that is like a red flag for some GI upset or pain or something like that, where the dog probably needs to go and have a workup done, to see a rehab professional, to see, an internal medicine specialist, something like that. In clinic, it is extra challenging because, of course, that's a novel environment. The dog could be under aroused. They may not be able to learn. And then, as was the case here, like, we kind of have to default to those exercises where we are doing the exercise to the dog because we don't have really a willing participant. And sometimes you just have to, sometimes you just have to put the dog onto peanuts and do an opposite leg lift. Sometimes that really just is the best thing. But the other option in the case of the dog who won't take food is to try and teach the human component how to do homework so that we can control more of the variables. And reduce arousal, increase the desire, which is the Susan Garrett thing. The dog has to have a desire to work if we're going to involve them as a willing participant in the process. And so that can happen in the home environment. With regards to raw, yes, that is interesting. So a lot of people will just, like, scoop out of the bowl, get it all under their fingernails. Some people will use like a wide gauge syringe, that's an option also. They put the raw in the syringe. Some people will use freeze-dried raw, which is another option, but that definitely is a challenge. We have to have
Mhm.
a reward that works for the dog. But I found as I increase the value of the experience itself,
Mhm.
that I can get away with using the dog's food for their reward. 'Cause
Mhm.
it's a lot of calories.
Mm. No, yeah, exactly. And often weight loss is a part of our goals, is one component of managing our patients. So, yeah, Robbie Porter
Mhm.
teaches Rob Possible. He does chicken, so
Yep,
they have chicken
yep,
and they break the chicken into
yep.
tiny pieces, and then that solves most problems because most dogs will do anything for chicken.
Who doesn't love a good roasted chicken?
Exactly. Yeah, yes, that's gonna cost a couple rand, right? All right. So thank you guys. I'm loving the feedback. Getting set for the day to see my furry clients while listening to this amazing live. It's great to have you, Chanel. So when dealing with shy or easily distracted dogs who won't take any treats in that physiotherapy setting,
Mhm.
how do you go about engaging them effectively? So are there other ways, other things that we could do to engage their attention? Um, you have kind of touched on that, but maybe do we use a different strategy instead of therapeutic exercises? Do we shift our attention to going into the underwater treadmill or swimming, or what else could we do to engage them?
Yeah, and all of those are valid options. This is a little bit outside my scope because of course I don't participate in this field in that way. But you might be able to use a toy. You might be better served doing manual therapy, dealing with those muscle imbalances from like a manual release perspective, um, teaching the handler, like I said, their homework exercises, providing them with homework worksheets, transitioning to the underwater treadmill,
Mhm.
or even gait retraining, all of those things. But it is a challenge to work with
Mhm.
dogs who are over under threshold, who are not interested in being a participant in what's being done to them. And
Mhm.
I did deal with this in human fitness stuff because humans come sometimes to their sessions scared, that they are
Mhm.
uncomfortable, they have been hurt in the past, they don't trust you, their last trainer hurt them. So
Mhm.
again, same as with the dogs, taking a step back to something that's very easy, simple,
Mhm.
easy for them to be successful, to rebuild that trust relationship again. So it's easy to get hung up on the ultimate exercise, like my rehab professional wanted to do opposite limb lift on the peanut as our first exercise. And instead of doing the exercise that would make her stronger, to take a step back and do something
Mhm.
that she can be successful with, right? Because in the
Mhm.
long term, that is going to be the thing that empowers the dog and handler to
Mhm.
continue this journey from rehab through rehab to their homework exercises to fitness long term. So
Mhm.
hopefully you never have to see them again, which is really
Yeah.
the ultimate goal.
Yes. Will you talk a little bit about luring?
Okay.
And yeah, because I think there's a lot there, right? And it feels like with the frequency of
Yep.
treats that you're giving, are you luring? Are you
Yep.
not luring? If
Yes.
we are luring, are we actually engaging the brain to
Mhm.
understand what it's doing and what the body's doing?
Yes. That's a great question. And so luring presents the food to cause the behavior. So, food makes the behavior happen. So, pretty quickly, I transitioned from using a food lure to using placement of reward instead. And so, I will change where I put the reward to help the
Mhm.
dog move into position And then I present the reward and let them eat it versus having them on the food while they're moving into position, right? And it's kind of a fine difference or a subtle difference, but I don't let the dog have the food until they execute correctly. And then I let them have the food. So that is reward delivered after the behavior. So that's rewarding versus luring uses the eating of the food to get the dog into position. So in the first few repetitions, I might lure, especially for a dog who is struggling. In the first few repetitions, I might lure them into position, but then pretty quickly, I ask them to come into position and then deliver the reward, which is where they have to think first. They get that neuromuscular connection, and then they receive their paycheck afterwards.
So how is that different from targeting, where the dog is touching a target and then getting a reward from a different hand?
Yes. And so it is very similar to targeting, and you can totally use targeting, except that targeting assumes that you have a pre-learned behavior that the dog is executing first to earn the reward. And not all dog handler teams have that skill. So this placement of reward strategy falls kind of between luring and targeting in that they are moving toward the food, but have to execute the behavior first before they earn their paycheck. Yeah. And so it's pretty natural.
Okay, awesome. Guys, thank you. There are still a ton of questions, but I'm going to cut us off.
Oh, no.
I'm sorry. So Nikki says that she uses squeezy tubes with raw food. So you have like something that's dispensing food on it. I like that. That's fair. Guys, thank you for joining us. Annalie, thank you for sharing your experience and your knowledge with us and being willing to come onto this platform. Stay on with me and we're going to book another session.
Okay, I can't wait.
Okay, guys, thank you so much. Annalie and I will come in to the recording and answer your questions and respond to your comments. We're not going to forget about you. We just have to, not go over an hour. So thank you, guys. Have a wonderful day.